I'm Annie Harrington. I serve as the Chief Legal Officer at Contexture. I am delighted to introduce our final panel, in which our outstanding speakers from the Colorado Health Institute, referred to as CHI, will offer a nonpartisan view of the state of the states, focusing on health policy. We are mindful that this panel stands between you and some well-deserved beverages, but I dare say it will be worth it. We are extraordinarily lucky here in Colorado to have a health policy organization like CHI that for the past 20 years has served as a trusted and independent source of the information, analysis, and expertise that supports sound health policy decisions. Although the work that CHI and Contexture do is different, our missions are very much aligned: to provide data and information to improve the health of all Coloradans. Health policy touches all of our lives in some way. The actions and decisions of our elected and appointed officials and agency staff, many of whom are with us today, impact our access to insurance or mental health services, as we heard Dr. Medlock so eloquently share with us today. It impacts our access to reproductive health care services, the rollout and availability of vaccines. Before turning the podium to our speakers, I want to spend just a few minutes connecting the health policy subject matter of this panel to the work we're doing at Contexture. Gotta fix my mic. For those of us in the health data and health IT space, we're living through a sea change in the health policy and regulatory waters. To mix metaphors, the ground is literally shifting under our feet with the introduction of new interoperability regulations at the state and federal level. Because nothing screams, "Get me to the bar faster," than a lawyer talking about regulations, I'm only gonna name a few. In the next 12 months, we expect to see the first substantive amendments to the HIPAA regulations since 2013. As a result of statutory changes in the CARES Act, SAMHSA is poised in the next 60 days to release a proposed rule that will change the way that Part 2 substance use disorder data can be integrated and shared with other HIPAA-regulated health information. We expect the enforcement rule, corollary to the no information blocking regulations, to be released any day, which will give federal regulators the ability to enforce the new information blocking rules and levy hefty penalties for noncompliance. CMS has signaled that its payer-to-payer interoperability requirements will be reissued in the near future. The Trusted Exchange Framework and Common Agreement that you heard on previous panels, also known as TEFCA, is slowly but steadily taking shape to enable greater data sharing on a national scale, or so they claim. And here in Colorado, the Attorney General's office has just this month, a few weeks ago, proposed regulations implementing the Colorado Privacy Act, which will change the way that personal information is regulated in our state. You're about to hear many more upcoming changes in health policy that will affect the way that we can exchange data and provide care in Colorado. For the lawyers and compliance professionals in the audience, this changing landscape is better known as job security. But for these regulatory changes, though they may impact how Contexture does our work, they will not fundamentally alter the relevance or importance of our mission. Indeed, Contexture and the Arizona and Colorado HIEs are in many ways the byproduct of state and federal policy. We have been fortunate over the course of our 10+ years to have received sustained investments from our state and federal partners. This public-private partnership model has enabled Contexture to respond to the needs of the communities we serve and to expand upon the important work that our healthcare agencies at the state and federal levels are doing. As many of the presentations made clear today, we're doing more than just the traditional health information exchange at Contexture. Our work has evolved as our networks have grown, and Contexture has, and many of our fellow HIEs nationwide, as indicated by the all-star panel of CEOs that were up earlier, are reframing our role in the health data ecosystem. We're moving from an HIE concept to a concept that really harnesses the health data utility model. Our health policy priorities, in turn, have matured accordingly. To talk you briefly through a couple of them before I turn the podium over, we're deeply focused at Contexture on supporting state and federal policy that will better facilitate the exchange of information among public health and clinical health systems in a manner that meets rigorous data privacy and data security standards, as I stare at my CIO. The pandemic has brought into sharp focus the importance that real-time data and interoperable technology can have not only in delivering patient care, but also in informing timely and appropriate public health response. There's an opportunity in Colorado to pursue a more coordinated and automated approach to hospital and other mandatory data reporting to state and federal endpoints by leveraging the significant infrastructure investments that have already been made in our state and that already exist in the form of the HIE. We're supportive of policies that facilitate such reuse and reinvestment of our infrastructure and believe that they'll not only reduce costs and burdens on our providers during public health crises and normal times, but would also lay the foundation for future emergency preparedness, planning, and emergency response efforts. I ran out of breath. Contexture will continue to build relationships with CDPHE, HCPF, OHI, and the new Behavioral Health Administration. Many of you are here, and we are so appreciative of you attending and of your support. We'll be supporting policies that better enable the integration and sharing of public health data through the HIE, including immunization information and prescription drug data. Contexture is focused on improving access to the HIE by rural healthcare, as you just heard, so we'll be sharply watching for policies that will help facilitate that approach. We're committed to more fulsomely incorporating behavioral health data in the HIE, something that our partners in Arizona and the Arizona HIE have mastered long ago. We're looking forward to partnering with many behavioral health organizations in the state, some of whom are here today, and with our technology partners to develop and pilot a consent-based model and to advocate for policies that facilitate information sharing in a way that accounts for technology limitations and empowers patients. We're evaluating the impact of the Colorado Privacy Act, so stay tuned for comments that we'll be submitting on those regulations coming up in the next couple of weeks. And finally, social determinants of health continue to be a hot topic. We will be closely monitoring any policy developments in that space and are looking forward to partnering with our state agencies to develop solutions for incorporating that type of information into the HIE. With that snapshot of our health policy priorities, it's time for you to hear from our two outstanding speakers who know their way around the Capitol and around the Colorado political scene. Allie Morgan is the Director of Legislative Services at the nonpartisan CHI, where she manages legislative relations and provides research, presentations, and commentary on developments at the state capitol. She coordinates the annual Hot Issues in Health Conference, which is coming up right around the corner in December, and I highly recommend to all of you. That conference serves to inform elected officials and the wider policy community about Colorado's most pressing health topics. Allie manages CHI's internal research agenda and leads consulting engagements with state agencies, health systems, and philanthropic organizations. She's been with CHI since 2014. Allie is joined on stage by her colleague, Joe Hanel, who serves as the communications director at CHI. Joe's role is to communicate CHI's health policy work to a broad audience, which includes reporters, legislators, health advocates, and voters. He also performs research and analysis on the intersection of politics and policy and the interaction of federal and state health policy. He's a member of CHI's Inclusivity, Diversity, and Equity Alliance, and he's been helping to draft the organization's first strategic plan in that space. Joe's worked at CHI also since 2014, following a 19-year career in Colorado newspapers, including at the Durango Herald's Denver-based bureau chief, covering legislature, federal courts, and statewide campaigns. Allie and Joe, welcome. Thank you for bringing it all together for us today at the end of our inaugural Colorado HIE Summit with a presentation that looks at our recent political past, the hot policy issues of today, and offers a sneak peek at what might be in store for our state post-election season during the 2023 Colorado legislative session. There will be time for Q&A at the end, so hold your questions. And with that, I'm going to turn it over to the two of you. Thanks for being here.
As was stated, we're here to talk about the state of the state, where we've been, where we are, and where we're going. So Joe and I have both been with CHI since 2014, but other than the fact that we have been doing these tandem presentations together for like 8 years at this point, Why are we here to give this presentation today? You'd have to ask your conference organizers to get the official answer. But really, our goal is to provide education. We're here to inform evidence-based analysis and decision-making, and so we get asked to give a lot of presentations like this to groups like all of you. If you're not familiar with CHI and our legislative services, we do not lobby, we do not take positions on bills, ballot issues, or candidates. And we just believe in providing evidence and analysis to everyone from elected officials to conference audiences. I often explain it as empowering everyone to argue with the correct data, which I hope resonates with all of you. So we're here today to inform you, not to sway you. And that really is the work of the Colorado Health Institute in a nutshell. Again, if you're not familiar with CHI and who we are, our team believes that good health policy leads to better health for Coloradans. And so that's the why of what we do. We're an independent nonprofit organization. We have a community benefit arm with lots of work that you can find on our website. We also offer a variety of consulting services for organizations, including many of you in the audience. So think about facilitation, evaluation, strategic planning, communication assistance, that kind of thing. Please reach out to us. We have a couple other CHI colleagues in the audience too, if you'd like to connect and learn how we can support your work. And finally, just a quick note that 2022 is a milestone year for CHI. It's our 20th birthday. We have spent a lot of time over the past 2 decades involved in health policy conversations here, and we're really excited to embark on that journey or continue on that journey for another 20 years. We've really just appreciated the chance to work with and learn from so many of you over the years, and we're excited to continue doing so. So thanks for being here today, and we're excited to talk with you about the state of the state.
Thank you, Allie. It's always hard to have the last slot of the day, especially knowing that a raging IT conference happy hour is right around the corner, so be nice to us. I'll outline where we're going today. We're looking at the immediate past, present, and future of politics and policy in Colorado. The past 4 years have been really pretty eventful since Governor Polis took office. He came in with these big plans that was very much focused on reducing consumer prices in healthcare and also re-engineering state government to make it more user-friendly, especially in the behavioral health and early childhood space. Obviously, the pandemic came along and kind of threw some sand in the gears. We're back at that now, at that original agenda now. In the present moment, there's still a lot going on right now. There's this unprecedented amount of money coming from the federal government. There's the impending end of the public health emergency. And of course, 2 weeks from today, there's an election, if you hadn't been watching TV lately. And where we're going is we're going to look ahead to the 2023 legislative session, and then a little bit more broader in themes of what Colorado's policy adds up to, and what the Colorado way is, what our image is. So where we've been, we've been through some stuff, haven't we? The past few years. Everybody here, even if you had it easy, they were hard years. Talking, of course, about the pandemic, we are not through it yet. I work at a public health institute, and I'm telling you, COVID is still with us, but maybe we have reason to hope that we're through the worst of it. So I want to look at how Colorado did compared to the other states, and the answer you'll see from these graphs is about average. Colorado is the yellow bar here, and the light blue bar is the US average. So this is our infection rate. We were right at the national average. No state was closer, more representative of the US average than Colorado. In terms of how many people here died from COVID, it was quite a bit lower than the average, as you'd expect from a state where the underlying health of people before the pandemic was a lot better than the US average. Our vaccination rates are about 4 percentage points higher than the US average. Pretty good. Rhode Island is at the top. We're not in their league here. But about 2/3 of Coloradans have received their full course of vaccinations. And then what stands out a lot is our policy decisions. And here, what we did here is looked at the total duration of mask mandates in days as kind of a proxy for how restrictive a governor wanted their public policy to be. There were maybe a dozen states that didn't have a mask mandate at all, and they don't show up on this. But the blue bars are states with Democratic governors, and then red with Republican governors. Colorado, again, is the gold bar. And you'll see that Governor Polis was more likely than most other Democratic governors to open up, to end the mask mandate earlier than. To the right of us here is Minnesota, and then the other three states they're more conservative states with Democratic governors. I think it's Montana, Kansas, and Wisconsin. And put all that together, how did our economy do? Say it with me again, about average. Colorado and the US really closely mirrored each other in their gross domestic product growth since 2019 is what this is tracking. The worst was Hawaii, where the tourism economy really took a hit during COVID. And the best performing state was Idaho. My theory on that is just all the French fries we binged on during lockdown. So that's kind of a capsule of the pandemic interruption and where we are coming out of it, how we did. I'm going to turn it over to Allie to talk about that Polis agenda and the Democratic agenda that got interrupted and is now getting back on track.
Thank you. All right, so to Joe's point, COVID has been a huge story, obviously, over the past 4 years, but has not been the only story in Colorado. We've had a lot of policy change in other areas of health and healthcare as well. State leaders, including Governor Polis, have really backed a variety of bills to achieve their goals of doing things like lowering costs and advancing infrastructure in Colorado. And 2 state offices have been especially important players in this space, I think, so I wanted to call them out. First is my favorite acronym among Colorado offices. Can anyone tell me what this stands for? Thank you, the Office of Saving People Money on Healthcare. It just makes me happy. I don't know if they have t-shirts with the acronym, but if they do, I would love to get one. So the Office of Saving People Money on Healthcare was created by Governor Polis shortly after he came into office in January of 2019. And through that office, he has worked really closely with others on his team, with legislative leaders, with other executive branch leaders, to go through a whole list of goals. And you can see some of those. I know they might be a little small for you all to see on the right side of this screen. Polis has called this, quote, the cornerstone of our efforts to reduce the cost of healthcare for Coloradans. And so there's just been a lot that's happened, right? A reinsurance program, a public insurance option, a powerful new prescription drug affordability board, transparency requirements, out-of-network billing regulations, all sorts of things targeting hospitals and insurers and others. Democratic legislators have often been his partners in this effort, but many of these have been bipartisan as well. And then I was going to talk about OHI, but I don't think I can do a better job than Stephanie did on the last panel. And so I think everyone already understands OHI and what the office is, but she did a beautiful job talking about the background of that office, when it was created, where it lives, the exciting work on the health IT roadmap in recent years. And so again, just wanted to acknowledge how important and notable that's been in terms of how our executive branch especially shows up in the health IT space. These state government offices are not static, as we know, right? They're being created and merged and elevated or demoted all the time. And I just wanted to also call out 2 that have really been, again, created or changed in recent legislative sessions. So the Behavioral Health Administration is something that has come up quite a bit today. I know you heard from the director, Dr. Morgan Medlock, this morning. 2 important goals, I think, for this office, which has really been charged with streamlining and serving as the single entity for behavioral health services in the state, are first, streamlining services, which I know I just said, and thereby avoiding duplication. There are still behavioral health services and staff in other places in state government. And so how can the BHA come in and effectively integrate that work and avoid duplication? And then second, I think Annie talked about this just a minute ago. There is a lot of system transformation happening right now in Colorado, and that includes, and especially in some ways, the behavioral health space. There has just been a lot that has been shifting. We have heard different providers and policymakers talk almost about a sense of whiplash that they're feeling. And so it's a tall order for the BHA to really come in and live up to that promise of stepping in at this time of a lot of transition and really managing to streamline and integrate at a time of so much change. And the state had an Office of Early Childhood that was recently promoted cabinet level department, and so now we have the Department of Early Childhood. This office is meant to unify Colorado's early childhood system and oversee things like the Universal Preschool Program, which is set to launch next fall. There are so many challenges in this space, not helped by the pandemic. So many providers, as you all know, had to close their doors, either temporarily or permanently, due to the pandemic. And then this was already an issue, but it has really exacerbated the challenge of providing enough slots of affordable, high-quality childcare for families. So just a moment of personal privilege here, because my household has been thinking about this a lot this year. Is anyone else here the parent of young kids? Okay, I see some hands up. Of those of you who just raised your hands, have you had a disruption in your childcare at any point this year? I see an enthusiastic hand up from Ashley Brown and a few others. Okay, have any of you had a disruption for at least a week at a time? Another enthusiastic hand up, a few others. Okay, if you are trying to work or just keep your sanity, having that kind of disruption is really difficult. I think in my household, we're up to a cumulative 6 weeks this year that we have lost in childcare. So this is just something that I think about a lot, and I am really excited and hopeful for the work of this department. We also, I'll just mention, have a paper coming out at CHI in the next few weeks about the accessibility of childcare and its impacts on health, and so if this topic is also of interest to you, I would encourage you to check that out. Before I move on, the last thing I wanted to mention here is that both of these departments really speak to the importance of connecting systems, which is the work that you all do each day, so I just see a lot of alignment here. And Colorado has also really leaned into advancing equity in recent years. I know that this is a priority for the folks at Contexture as well. The state has really shown this commitment through a variety of ways. There have been executive orders, there has been legislation, there has also just been a lot of small p policy decisions made by organizations who are represented in this room and many others. And so I think it's been exciting to see so much of this movement. Governor Polis had an executive order, or created an executive order that required a handful of things for state agencies that I think are notable, including training for all state employees on diversity, equity, and inclusion, and also mandating the creation and regular updating of these department-specific equity strategic plans. You can see the cover of the plan for HCPF, the Department of Healthcare Policy and Financing, on the right. These are pretty robust. I think this plan is like 83 or 84 pages long. And so there's been a lot of work and thought put into this, and I think the question now is how are these going to be used, and how will we keep an eye on what success looks like as we continue to advance this statewide? I also just wanted to call out a successful 2021 bill that mandated the creation of a statewide equity strategic plan by CDPHE, also requires more assessment of social determinants of health. This is something that I've heard about in a variety of conversations today. And helpfully, this bill provided extra money and staff to get these things done. Seems like a wild idea, but it doesn't always happen, right? Occasionally there are bills that are calling for more work but don't come with the funding and the people attached. And so this is just another signal, I think, that the state is serious about accomplishing this. Okay, when we turn specifically to HIT and HIE legislation, I think it's safe to say that the legislature is getting more interested in this topic. And so it's important to pay attention because there's quite a bit happening that I think is of interest to all of you and your work. Just to give me a sense before I jump into specific bills, can you guys give me a fist of 5, fist is 0, 5 is the max, of how closely you'd say you follow the state legislature and bills? There's not a right or wrong answer here. Oh, my contacts are so dry. Okay, I'm seeing like, oh, I think I see every single number represented. This is not exactly what I was planning, but I think I saw a lot of like 2s and 3s, majority 2s and 3s. But that's great that we have a diversity of background here. So some of these bills are things that you all may be familiar with. Some of you may never have heard of this. That's all totally fine. A few bills from 2022 that I wanted to call out that I think are good to have on your radar going forward. House Bill 1278 stood up the BHA, but what I actually want to focus on here is Senate Bill 177. This was a companion bill that really got at a lot of the more technical components for the BHA. And the biggest thing that this bill did is require the creation of a cloud-based platform for the BHA so that any providers who don't use an EHR can still participate in the care coordination infrastructure. Almost $6 million was allocated for that purpose for each of the first 2 years of that bill taking effect. This policy really came at the direction of the advocacy community, and I think it represents an example of how state policymakers are really providing some pretty specific directives for the work of state agencies and others. House Bill 1380 required a new electronic system within the State Department of Human Services for managing various benefit applications that just have not interfaced with each other. So think about the SNAP program, LEAP, Colorado Works, Medicaid, a lot of programs designed to serve lower income individuals and families. This bill also requires some programming updates that were sorely needed and creates a new state community food access program. So there's a lot packed in there, but there's $6 million in ARPA funding to support the human services systems integration work, and even more than that in the food access program. And then like the above legislation, House Bill 1302 didn't focus just on HIT, but I think it has some really important pieces and incentives in there. This bill created a new statewide integration grant program intended for primary care clinics across the state. And notably, that bill requires applicants for the grant program to show how they plan to use technology to improve whole person care, how they plan to participate in peer learning in different ways, and find better ways to do things like conduct electronic screening and referrals. And so requirements like that can encourage the adoption by providers of specific technologies and standards by tying them to incentives in a way that sometimes can be really effective. And I think this is also a reminder that important requirements can pop up in legislation that might not appear fully focused on HIT on the surface. Okay, so that's where we have been in a nutshell in recent years. I want to shift now to the present. So what are some of the immediate things that we have on our radar around health insurance, federal funding, and the election that, as Joe mentioned, is in 2 weeks. I cannot wait for the commercials to be over. Okay. Something being watched by a lot of folks in our world, including many of you, I'm sure, is the end of the Federal Public Health Emergency, or PHE. This has been extended every 90 days, right, since the beginning of the pandemic. That just happened again a week or so ago. And so that's going to carry us through early January. But after that, the continuation of the PHE is uncertain. And so that really requires planning now and hopefully before now. Quick background, if there is anyone in the room who hasn't been following this, is that before COVID, state Medicaid agencies evaluated the eligibility of all of their enrollees annually, and they disenrolled folks who no longer met the eligibility criteria because maybe they had started making too much money or they'd moved out of state, for example. But in order to get and keep as many folks covered as possible during the pandemic and the public health emergency, the feds offered an additional match as long as folks didn't get disenrolled. So you could add more people to Medicaid rolls, but as long as the PHE is in effect, you can't take anyone off. And so this is what has happened to Colorado Medicaid enrollment over the past 2.5 years or so. You can see that it goes steadily upward because, again, new folks have been added, but no one has been disenrolled. And so that's added to about 500,000 people at this point. There are just a lot of questions at this point around how many people are going to shift off of Medicaid when that happens, what kind of impact this might have on our state's uninsurance rate. And before we even get to those points, how are our existing systems and staff going to handle eligibility redeterminations for this many people at one time? This is really going to test the system. And the Commonwealth Fund has also pointed out that so many people have moved or lost their housing since the beginning of this that it's just an additional layer of complication. Think about normal moves and life changes, the economic recession, natural disasters that we have all dealt with, including in Colorado, unfortunately, since the beginning of the pandemic. And so this is just a big challenge. And growth, of course, did not just happen in Colorado. The Kaiser Family Foundation estimates that Medicaid enrollment nationally has increased by about 22 million people since the beginning of the COVID-19 pandemic. So who are those people? According to Kaiser, about 40% of them are children, and about another third are ACA expansion adults. And so we're talking about a lot of kids and families here who make up those people who have gained coverage. With the end of the PHE, Kaiser estimates that enrollment losses could range from anywhere from about 5 million people nationally to 14 million people nationally. And so while most people will likely continue to be eligible for Medicaid or coverage through a marketplace, are not small numbers we're talking, right? And since states won't be able to continue receiving the higher federal match once the PHE is over, there are some concerns that this might rush them or encourage them to rush the eligibility redetermination process, even if they technically are allowed more time. Colorado and other states are considering various options to try to make this go more smoothly, things like using SNAP renewal, for example, to help figure out eligibility for Medicaid.
Thanks, Allie. The second big policy factor in the right now is also related to the federal government, and that's this just crazy amount of federal money that's here through the American Rescue Plan Act, also the infrastructure bill, the Inflation Reduction Act. I've heard it said that it's the biggest federal investment in the state since the New Deal. So at CHI, we built a financial map for the American Rescue Plan Act that tracks more than $9 billion in funding to public entities. So we're talking about not just the state legislature, but things like school districts, even airports that came through ARPA. The part of it that you probably heard the most about is what the legislature had. They had $3.8 billion. And for the most part, they appropriated all of that in the 2022 session. There might be, $10 million here and there left over, but chump change, right? But just because the legislature has decided on it and appropriated it, the takeaway is that it's not, the money isn't spent yet. Where it is usually at a state agency, and those agencies are issuing grants or RFPs to put that money out on the street. This year, next year, we just haven't begun to feel the impact of a lot of it yet. If you want to give our little interactive graphic a whirl, you can go to colo.health/CO ARPA22. You can see the link here, and it'll be in your follow-up from Contexture. Or you can just go to CHI's website and check it out. It's a fully interactive graphic and lets you know each bill with some links and what agency's getting it and all that. So hopefully it's of use to you. And then finally, the third thing, the third really in the now factor that's so important in the policy community right now is the election. It is 2 weeks from today, but ballots have gone out already. Anybody voted yet? 1, 2, 3, 4, maybe five. You're way ahead of me and just about everybody else in the rest of the room. I just got a text just as I was sitting here urging me to go vote for one of the ballot initiatives. It's a big election. There's everything but the presidency is on the ballot. There's a U.S. Senate seat, 8 U.S. House seats. In the state, we've got the governor and the other 3 constitutional offices. We have all 65 seats in the state House and 17 of the 35 in the state Senate. And then there are almost a dozen ballot measures. 3 of them have to do with retail alcohol sales, but the important ones those are the important ones to normal people. The important ones to us are Prop 121 and 123. Prop 121 is an income tax cut. And if it passes, it would cut inflow of money into the state treasury by about $400 million. And Prop 123 is about affordable housing. And it tells the legislature that it has to spend money that is already there, not to raise taxes, but money that is already in the state budget on affordable housing. That would cost nearly $300 million. So if both those pass, the legislature has $700 million less to work to balance the state budget. And that's going to go from last year's good times, let's spend all this money, to maybe some pretty ugly times when the budget comes around in March and April. I want to look back for just a second on this idea that Colorado is a purple state, because when I put this graphic together, it started to change my mind a little bit. If we go back 20 years, we see we had a Democratic governor, Roy Romer, and a Republican-controlled House and Senate. In that pattern, you could extend this graph all the way over to like the exit sign over there, all the way back to the mid-70s. It was like this. But things started to change in the late 90s. This is when Republicans reached the peak of their power with Governor Bill Owens and the legislature, for the most part, with a little interruption in there. And then they changed again really rapidly, starting in 2004, when Democrats flipped both the House and the Senate, and then Bill Ritter was elected governor, and then Hickenlooper, and then Polis. So this doesn't really look like a purple state to me. And in fact, if you want to look at the control of the trifecta, they call it, governor, state, and House, Democrats have a more solid hold on the trifecta than either party has had in the past 50 years. You'd have to go all the way back to the early 70s when Republicans had a long-term trifecta. So this should be the year for Republicans to break through. They're hoping that they can flip the state Senate, but they're at a deficit there, 21 Democrats and 14 Republicans. So they need, and it actually got worse even before the election because one senator switched seats to join the Democrats. So it's a steep climb for them. My question is, if it doesn't happen this year, when you have a Democratic president whose poll ratings are low and inflation that's sky high, when's it going to happen for Colorado Republicans? So the takeaway is probably that if the polls are right and Polis is reelected, that these policies that Democrats have been enacting the past few years are going to be pretty durable. This is the policy environment that we will have for the next several years, and probably a lot of the innovation that they've worked on the past few years that Allie went over, they're going to be shifting to institutionalizing that. So I want to shift really quickly to the individual candidates because personalities matter. And to analyze that, we looked at Google search trends data, and this just through Colorado. It's a pretty good proxy for how interesting your average person finds a topic. So Senator Michael Bennet, an incumbent, Oh, and I should say this graph it's relative to itself. Google doesn't give you the numbers to populate the y-axis. So it's just, we're just going to compare people to each other based on the shape of the graphic itself. Michael Bennet is not all that top of mind for somebody who's been in the Senate for 14 years. But his challenger, Joe O'Dea, he's a newcomer to politics and just never really broke through in the popular imagination. Bennett's almost always been more searched than O'Dea is. Heidi Ganahl, the Republican candidate for governor, did have a breakthrough moment when she won the primary back in June. But since then, she's kind of back down along with O'Dea. Sitting governor, Jared Polis, consistently does a little bit better than just about everybody. He got some good national press back in December for his pandemic policies. I think that's what you're seeing there. But of course, if you're talking about Colorado politicians, the literal elephant in the room is Congresswoman Lauren Boebert, who is really a non-traditional political figure, right? I mean, she's more of a media personality than an elected lawmaker. The spike you see last November, I think that's when she sent out her Christmas card that had her family posing with guns in front of the Christmas tree. So that's, if you're not familiar with Representative Boebert, that's what drives these spikes. And now, if we look at it nationally, there really is only one Colorado elected official to speak of in terms of the popular imagination, and that's Representative Boebert. So this, I'd argue that this matters because Representative Boebert is more like a kind of trash the system type of a person. She's so radical, she rejects a lot of the establishment. And this is a place where people aren't trying to tear down anything unless it's silos. But really, we're trying to build something up here. And it matters for the national image of Colorado and the investment we'll get from outside. And that segues into where we're going. In the future, what is our brand? What are we building here in Colorado through public policy? Before Representative Boebert, we were known, you say Colorado to somebody not from Colorado, and they say marijuana, and it was just endless jokes and punchlines, right? If you're paying a little bit more attention, you might think of Colorado as this unaffordable paradise where, everybody wants to be, but nobody can make the rent or afford to buy a house. But I think there's a third way, and it hasn't reached the popular imagination yet. As our last panel said, it may never, but Colorado is a place where we really are building connections. I love the symbolism of this map. You can see the Front Range in that kind of big, dark area all west of the Mississippi. We're a regional capital. And since this is Contexture, I'd add Phoenix down there, kind of the two poles of the Intermountain West. And not only that, but this is a place where, forget about the cowboy image, forget about the pot smoking image. This is a place where people with really good intentions come together to build something together. I think that's what everybody who's remaining in this room is, and was here earlier today. At our heart, that's what we're all about, trying to knit together a system that serves people better. So keep that frame in mind as we go into the 2023 legislative session. I think that's something that we can all be advancing together. And Allie's gonna, Ivy's my daughter's name. Allie's gonna take a look at that session right now.
I would love if you and Ivy gave a presentation together. I would be there in a heartbeat.
I'm so sorry, Allie.
I'm flattered. Ivy's great if you guys know Ivy. Okay, so turning just to the 2023 legislative session, and then we'll be wrapping up I wanted to start with the budget at a higher level because it's honestly just a little bit too early still to talk with a lot of specific detail about what we're going to see. This always happens in an election year, right? Legislators are generally not focused on drafting their bills right now. They are focused on getting reelected to their seats, and then there will be this scramble to get everything ready before the session. But so much depends on the state budget. And not every introduced bill, of course, costs money, but a lot of them do. And so I think understanding both how the dollars are allocated among state departments and then how the financial picture of the state is looking more broadly is just super important context and helpful as we go into the start of each session. So these two graphics show a high-level breakdown of this current year's state budget. As introduced, you can see total funds on the left, and then the smaller portion, which is the general fund on the right. The general fund is basically what the legislature has control over. The dark blue portion in the upper right is a bunch of different departments put together, but then everything else shows individual state departments. And so what we point out every time we show these graphics is how much of our state budget is accounted for by Medicaid, which is in the green, and by K-12 education, which is in the yellow. You can see higher ed and human services also taking up significant portions, but this is partially why we spend so much time talking about Medicaid enrollees and talking about kids and education in Colorado. So when legislators think about allocating dollars for new programs next year, I think it's important to note that so much has recently been created that they're going to have to keep in mind that they still have to pay for all the things that they already did. Right? And so when we think about the new Behavioral Health Administration, for example, that is currently sitting within the Department of Human Services, the light blue chunk of that bar, which is sizable but not huge. And the BHA still has a ton of positions to fill to get up and running and to do that work. And so legislators just need to keep thinking about implementation going into next session. ARPA dollars, of course, are time limited, right? And so that's really impacted what they have been used to fund. And then the latest economic revenue forecast in September just shows that the economy, not surprisingly, is starting to cool down, right? After years of what has been called extraordinary economic growth, we're starting to feel the impacts of inflation. And the state also has TABOR refund obligations, of course, that we have to keep in mind. And so just a lot of what can or can't be accomplished next year depends on how that picture continues to shape up, and then the results of some of the ballot initiatives that Joe talked about. We do know in terms of more specific topics that behavioral health is going to continue to be a huge focus at the Capitol next year. Of course, the pandemic exacerbated already serious issues with mental health and substance use in our state, and legislators have deservedly spent a lot of time talking about this. And I think that there's been a fair amount of bipartisan agreement and movement in the behavioral health space. Where I think specifically, though, there's been less agreement is around substance use. I think we've seen a lot of bipartisan momentum for mental health, but we're starting to see some inter and also intra-party disagreements around substance use. And you'll know if you followed last legislative session that one bill that just took a ton of time and attention was about fentanyl, right? The criminalization of possession and distribution of fentanyl. That bill was passed in like the final hours of the session and just chewed up a lot of time and energy and media attention. Of what we've heard is that that discussion is coming back. And so I would expect to hear more about fentanyl and about substance use and criminalization next session. I also would expect to hear more about the intersection of behavioral health issues and the criminal justice system more broadly. That could be everything from figuring out how to continue to expand these models that have been really positive and seem to work, right? So I think about the co-responder programs that a lot of communities have really held up as successes. But I think that there will also be conversations just around crime in general and what the connection with behavioral health issues and crime is next session. And then it's also become just increasingly difficult to kind of disentangle housing and the issue of our lack of affordable housing in Colorado from behavioral health issues. We know that being unhoused leads to lots of behavioral health challenges and vice versa. And so legislators will continue to deal with and struggle with, frankly, this issue of how to provide more affordable housing to communities across our state. I think we'll also still hear about other social factors that people are just continuing to acknowledge are really intertwined with behavioral health. So that's everything from employment to transportation. I think those social factors will continue to be talked about. And then policies to reduce health costs and improve access to care will definitely still be near the top of the list for legislators, probably for executive branch leaders as well. After all of this policy change in recent years, like the public option, like the reinsurance program, what's going to be the next big thing here? I'd love to hear at the happy hour if anyone knows, but I think that there will continue to be discussions around how Colorado can be innovative as a state in this space. Whatever that is probably going to be dependent to some degree, the ability of our systems to work together, our data sharing, our data governance, which I imagine is music to all of your ears. I think this is an important opportunity, right? This stuff is complicated and it's intimidating to many of our state policymakers, and so it's important for them to have folks like you all engaged and weighing in and helping sort of make sense of these data and systems issues that are just really tied to a lot of what they're considering. And then it's difficult to do things like save costs and have functioning systems if you don't have enough people in the healthcare workforce. There have been a lot of conversations around recruitment and retention and how to support our healthcare providers after the past few years that we have been through. ARPA dollars were really helpful for some provider issues, but also couldn't responsibly be used for other things, like educational pipelines, like rate increases, because they're time limited. And so I think legislators will continue to struggle with how we can solve this issue and recruit and retain more healthcare providers. Okay, so if you want to follow along with the legislative session next year, if you were one of those people who was like a 2 or 3 or below when I asked earlier, the state makes it pretty accessible to do so via their website. January 9th is when the session should kick off, should be ending in early May. There are lots of things you can do on the website. You can find your legislators based on your address. You can search for bills by keyword. You can even click on watch and listen in the upper right to tune in and watch floor debates or listen to committee hearings live if you need something to do at your desk or at 2 o'clock in the morning, if it's one of those days. There are lots of different committees to follow, and that can feel overwhelming when you look at the committee page and there's like 50 of them listed. But a few that I just wanted to call out to have on your radar are the standing health committees. There's 2 in the House and 1 in the Senate. The Joint Technology Committee, which I heard referenced earlier, that just means that it has members of both the House and Senate who sit on it. And then the Finance and Appropriations Committees in both the House and the Senate. The Appropriations Committee is a really important one to keep an eye on in the second half of the session, because any of those bills that cost money tend to get to that committee and then sit until the state budget is approved, and then it's just like a waterfall. And so you'll see that committee sometimes hear 20, 30 bills in a day going into the month of April. And so that's just a good one to have on your radar. And of course, we'd love for you to engage with CHI as well. If you haven't already, we have tons of resources available for free on and off our website. We have legislative reports if you want clear summaries of what's happened. We have our Summit Up bi-weekly newsletter you can sign up for. We have some really exciting partnership work to advance things like social health information exchange that we have been working on with many folks in this room. And then we have our monthly Eggheads webinars, which are on Thursdays. The next one is actually this Thursday morning about integrated systems of care. So perfect timing if you haven't signed up and you'd like to attend. We would love to have you there.
Thank you so much, and I'll just wrap up with a little bit of fast forwarding and an invitation. Our own conference is called Hot Issues in Health. It is December 9th, Friday, just down the road at the Inverness Hotel. You can go to our website and it should be pretty much front and center or at that short link right there. And has anybody signed up, by the way? 1, 2, all right, my new best friends. These are the cool people. Talk to them at the happy hour, see how they do it. And with that, thank you so much for your kind attention.